Let's join now live via Skype Ballad Health Chief Infection Prevention Officer Jamie Swift. Jamie, thank you. Numbers not going where you want them to go, I know. What do you think's behind this latest surge in hospitalizations?
You know, I think we've seen several things. So I think mask wearing has reduced some in the region. We know that there has been some variant cases identified in the region, and then you have travel. And so all of those things coming together really have brought about spread in the community.
I think many are hoping that the vaccination prevalence that we're seeing now with thousands of people getting them, that would help and not that would stop this from happening. Are you discouraged? And what are you thinking in terms of how vaccinations are playing into this?
The numbers are concerning, but certainly not discouraged about the vaccination efforts. So we know that we are nowhere near herd immunity yet with our vaccination efforts. So what we don't expect to surge back up to 370, 400 patients. We do think the vaccine will have enough effectiveness to, enough coverage to prevent that from happening as far as percentage of people vaccinated. But people have to remember that yes, we're vaccinating, but we have a long way to go. And so we need everybody to jump on board and get that appointment and get that vaccine, and that's how we keep these numbers going down.
Vaccines are widely available, and we're continuing to hear from people who have hesitancy about getting it. I know you're dealing with that with even your own staff, people who are just not wanting to get that vaccine yet. Are you seeing certain areas where there's greater prevalence of hesitation when it comes to vaccination? Any age group, any demographic that's got you concerned?
Not really. I mean, we saw really good uptake in that 65 and 75 and older, but anything beyond that, there seems to be a wide array and a wide variety of hesitancy and their reasons. And so it's honestly about trying to connect to those people, to those individual groups, understand their questions, and help them work through the information to reach that decision to make the vaccine, whatever it is.
Worth asking again, have you seen any data that has made you question the effectiveness or the safety of the vaccines that are out there?
Absolutely not. I mean, the data that we're seeing even internally as far as our vaccinated team members is really compelling as far as positive cases before we introduce vaccine and positive cases after. So, you know, everything we're seeing is that the vaccine is very effective. The real world trials, now that we know that we've been beyond Pfizer trials or Moderna trials to actually really world experience, those studies are showing the exact same thing, that they're very effective and very safe.
Last week, the CDC updated some guidance on travel and spoke to those who've been fully vaccinated and those who have not. What's your recommendation to people who are planning travel or maybe coming back from a spring break trip or planning that summer vacation?
Yeah, I just recommend that people do it safely. So make sure that you know the prevalence of where you're going, how their current spread is. If they've had variant strains, you know, make sure that you can try to limit yourself, social distance, still wear a mask if you're in crowds. Enjoy your vacation, but try to do it in a very safe manner.
If you've been fully vaccinated, the CDC says you're pretty much thumbs up for travel within the country, right? I mean, that's got to be encouraging to some people.
Right. Their guidance hadn't been updated and was still recommending quarantine even after travel. Well, given the fact that they're spread everywhere, it doesn't make sense to travel to the beach and then come back and have to quarantine 10 days. So they've really updated that guidance. So I don't think it's a free-for-all to go travel. I think they were just updating their guidance and making sure that people still do it safely. You do have much more protection if you're vaccinated. We do want you to be able to return to those normal things such as travel and visiting with friends and family. Just do it in a safe manner.
Finally, Jamie, we've heard that Ballad is going to be expanding hours at their vaccination clinics. Tell us about that and why that's happening.
We're really excited about this announcement. So as we move from our vaccine target of those people who may be retired to really the 16 and up crowd, so working adults, people in school or college, we understand that 9 to 4 hour necessarily didn't work for them. And so we're changing in Tennessee currently. The Virginia hours are staying the same, but in Tennessee, the two locations are changing from 2 to 8 p.m. or 3 to 8 p.m. And that really is to help some of those people who just haven't been able to come in during the day.
I was seeing this last night trying to help a relative sign up. Ballot Health, I mean, even this week you could get appointments 7 o'clock at night, 7:30 after work. So this is coming soon, right? When are you rolling this out?
So it actually went live this week as far as online scheduling, or if you call and make an appointment, you can get an appointment for this evening. Now, for the evenings for the rest of this week, it's really important for people to know if you have an appointment already scheduled and it's in that 9 to 4 hour, there will be someone there to take care of you. So we're kind of in that transition week, so our second doses are still coming in from that 9 to 4 hour. We're transitioning the first doses to that 3 to 8. So, if you have any questions, call Nurse Connect, and we'll certainly help you answer those questions.
Jamie Swift at Ballot Health, thank you so much. As always, we appreciate it.